Doctors of Reddit, what's something someone came to the hospital for that they thought wasn't a big deal but turned out to be much worse? I'm an ER nurse. I cared for a patient that came in because she woke up with a severe headache and a knot on her head. She went to CT for a head scan and had 2 bullets in her head. One had gone in at the top of her head, just past her hairline and traveled under the skin, but on top of her skull to the back of her head. The other went straight in, but just fractured the skull behind her ear, didn't go all the way through the skull. They were smaller caliber bullets. Apparently, she went to sleep the night before after taking an Ambien and there was a drive-by shooting on her street. The bullets went through her window and she slept right through it. My best friend's sister went to the hospital for what she thought was a lingering flu. She walked out with a diagnosis of bowel, stomach and liver cancer and died 9 months later. Doctors of Reddit, scare the it out of me. Had a guy come in complaining of a cough and difficulty swallowing. He thought he had tonsillitis and just wanted some antibiotics. I noticed his voice was incredibly hoarse but there were no swollen tonsils, so sent him for a chest x-ray. Huge, baseball-sized tumors all throughout his lungs. One of them was pressing on the recurrent laryngeal nerve causing his speaking and swallowing problems. He died within a week. When I was doing my hospital placements, a patient came in laughing and skipping for their scan. They thought 100% they were in remission and clear of cancer growth. I was spending a day with the scan techs and sat in. The scan didn't show one tumor, it showed hundreds. The guy was riddled with metastases. It was terminal. He had months. He was laughing and smiling with us. He asked if we could tell him how it went, and the tech said we couldn't. It was for the doctor. The old man winked at us and walked out. He was so happy. It was one of the days that told me I couldn't do that job. Edit. I've had quite a few people ask what I do now. How did I got into it? I edit a medical journal. I might do an AMA or something. A coworker of mine was hit by the boss car. Turned out she had rabies. Practically saved her life. A year or 2 ago here in Texas, a woman went to her optometrist for a regular exam. She later told the news after a long silence. He asks, "Did you drive here?" "No." "The person who drove you here needs to drive you to a hospital immediately." "Why?" "Because you're about to have a stroke." Don't have much time, so I will keep this short. Patient presented with a small, less than 1 inch, scratch on his right thigh and severe pain and immobility. On palpation there was crepitus, a cracking sound. We called in a surgeon in the hopes that we could excise the closed wound. But as soon as the surgeon cut the skin, the leg deflated. Yes, deflated. The escaped air was horribly putrid in odor. We ordered an x-ray and discovered the leg was simply skin and bones without any signs of muscle. I regretfully informed the patient that we had a strong suspicion of a flesh-eating bacteria called Clostridium perfringens and that the infection was spreading fast. He called his family and loved ones, got a lawyer and said his goodbyes. 12 hours after admission he was declared dead. I thought I had a nasty flu strain. Was feeling generally like crap. Didn't go to hospital until 2 days later. Was in operating room less than an hour after that. Appendicitis. For instance, I thought I had food poisoning. Then they emergency took out my appendix at 1 AM. Not a doctor. Sorry, I'm gonna be that guy. After I got my appendix out, I went back a week later thinking I was constipated. Nope. I had a giant ass abscess that had started to wall itself off. They went in the drain it and I woke up in ICU 5 days later recovering from sepsis, septic shock and kidney failure. The 7th of December, 2012. We brought my father-in-law to the ER because he just wasn't acting right, mixing words. Feeling tired, my husband and I thought for sure he had a mild stroke. The ER staff thought he had a stroke too, because of his symptoms, and he was 79. They did a scan and nope, cancer. 3 huge tumors in his brain. We took him for more tests the next day and it was lung cancer. A tiny spot in his lung that traveled to his brain. He died 13 days later. On my husband's birthday. Not a doctor. But a couple of years ago my mother had lump in her breast, so she went to get it checked out for breast cancer. Her mum died of breast cancer and her sister has had it twice and has had her breast tissue removed. Fortunately, however, it was just a cyst. But wait, there's more. Turns out hiding behind that cyst was some early stage cancer. Was easy to get rid of and she's fine now. Edit. Typos. Not a doctor, but I was in a fender bender car accident. I was at fault, and my lower back would not stop aching. I went into the ER figuring I had sprained the muscles in my back and that I would be prescribed muscle relaxers and maybe some pain pills. 6 hours. Several x-rays, a CAT scan, and 4 doctors later, I found out my spine was broken and, get this, healed. The best theory any of them could come up with was that my spine had broken during birth, and since we never knew, just healed itself, filling in with cartilage. One of the docs told me that had we known my spine broke at birth, I would have likely never walked and would have been treated as handicapped my whole life. I didn't find out until I was 20 and already had a child. My mom cried because she always thought I was just a really colicky baby, when in fact I was probably in a lot of pain. Not a doctor, but I was taken to the ER for what I thought was a small infection, even though my arm went numb cold. For some reason I was entirely emotionally distraught and couldn't think clearly. The doctors took care of it, and I ended up not being able to use my arm for a week. Turned out, it was a staph infection, and I was told that if I had waited 2-3 more days it probably would have killed me. My mother was in town visiting for Christmas. Suddenly she was slurring her speech, acting belligerent, all around confused. Tested her blood sugar and all it said was error. We get to the ER and she passed out. Her blood sugar was a 19. Her liver spontaneously failed. The best the doctors can guess is she caught a virus and it attacked her liver. 4 days after the onset she got a liver transplant. 22-year-old woman in Baton Rouge, Louisiana gave my mother the ultimate gift. Please, become an organ donor. Please. Not a doctor, but one night, I suddenly had serious stomach pains. After failing to sleep it off, my parents wanted me to stay home from school, but I declined for I had quizzes that day. I sat through US history, algebra II, and even tried to eat lunch, still in agony. So, after finishing my English quiz, I waddled down to the office and called my mom to get me. At this point, the pain is so bad I can barely stand, so my mom takes me to the doctors. Turns out, my appendix was ready to explode. When I was 12 I had a crazy bad headache that wouldn't go away. My dad brought me to the doc and I didn't even make it to the exam room before they turned me back and sent us to the hospital. It turns out my headache was from a burst sinus cavity, as in all the bones around my eye broke and the liquid leaked back onto my brain, giving me brain meningitis. My eye was bulging out to the point where I looked like an alien and they told my parents I was not going to make it. Obviously I pulled through but was hospitalized for 2 weeks and missed 2 months of school. I was at the time only the 3rd known case of this happening and they had flown in doctors from all over the US and from the UK. Crazy stuff. I thought it was just the worst headache. Turned out to be so much more. Not a doctor, I'm an EMT, but when I was deployed to Afghanistan as a medic, a medevac pilot came in because he had a small abnormality on his flight physical EKG. Apparently this was something he had been getting waivers for years for. I had just finished an ANT class and learned about something called Brugada's syndrome, which is basically an arrhythmia that causes sudden cardiac death in the patient. I jokingly mentioned how his EKG reminded me of the abnormality I saw in my textbook, thinking there was no way he actually had it and it had to be artifact from the EKG. The doctor's eyes widened and he sprinted out of the office. The pilot had it, was immediately relieved of flight duty, sent home and had a defibrillator put into his heart before being medically retired. TLDR, I accidentally diagnosed a man with certain death. Edit. Holy cow, this really blew up. Thanks for the gold. Kind stranger. Paramedic here. We got called out one Christmas for a grandfather who was tired after eating a huge turkey dinner. We get there and the first responders are standing around outside in high spirits. I walk in, slap a EKG on him. Massive MI, heart attack. Went from happy turkey coma to heart attack in 3 seconds. My sister-in-law thought she had a cyst on her shoulder. Nope, round cell sarcoma. The doctors said she had 2 months. She lived for 8. My mother woke up one day and her arm was numb. After about 45 minutes it was still pretty numb and she thought she had pinched a nerve in it sleeping, but went to the ER just in case. She had a stroke, which actually was caused by a blood clot. which moved up from her heart and exited a hole in her heart, a congenital defect she was unaware she had. She ended up fine and feeling in her arm came back, but she was incredibly lucky that it did. Not a doctor, but my ER doctor told me if I had waited 12 more hours I probably would have died. So I was taking antibiotics for dental work that had been done, and noticed these weird blisters showing up everywhere. Weird, but whatever. 48 hours later, they started opening up, leaving holes in my skin. No blood, just lost most of the skin in that area. Again. Weird, but I was working so whatever. Then they started appearing in my throat, so I got to the hospital ASAP and was diagnosed immediately with Stevens-Johnson syndrome. Any longer and the layers of my skin would have literally peeled away from each other and I would have died. That was a sobering day. 16-year-old girl brought to the ER by her mom because of flu-like symptoms for the past week. Check her blood, more than AML, acute myeloid leukemia. Despite treatment, more than dead in 3 days. Not my story, but a good one. A guy was involved in a MVA and ended up dislocating his hip. Got him strapped in and taken to the hospital where they ended up popping his leg back in. Now, dislocating your hip isn't very common. The upper end of the thigh fits in like if you were to make a fist with one hand, and then cup your other hand around it from the top. There's also quite a few ligaments and tendons really holding it in there, so when they pop it back into place, there's a significant amount of force holding it in. Anyways, the guy was in pain but conscious during the transfer, and when they got him to the hospital, I forget what drugs they gave him, but he was still making sense and responding appropriately. This changed as soon as they put his leg back into his hip. PT immediately screamed and passed out. He then proceeded to wake up, scream, and pass out again. This happened several times while the doc started to panic trying to figure out what had gone wrong, eventually sending the guy for x-rays. Turns out that his testicle had rolled into the cavity between his hip and his femur, so when they popped it back in it crushed his nut. So, yeah, that turned out to be pretty goddamn serious I feel. This thread is a nightmare for hypochondriacs, yet I click on it anyway. As someone who has a phobia of the doctor's office, I can't believe I even clicked on this thread. We got an older patient in the ER because he fell from a stool while replacing a light bulb. The family just wanted him to be checked because he fell on his head. He had nothing. While waiting for the papers, the family started to scream, "Doctor, doctor," when we rushed, and it seemed as if he was having a cardiac arrest. We put him back on the bed, hooked up an ECG. He had an AV block. So the reason he probably fell from the stool was because of the AV block. At first he was such a happy guy and joking around. After we told him what he had, he could only say, "It's in my heart. This means the end is coming." And TLDR came in because he fell from a stool. Fell because of a heart condition. As a physician, listen to your bodies. You guys know yourselves much better than we will, even after talking to you in an ER for 5-10 minutes. If something is going on that is far outside the usual, please come into the ER. I would much rather see you and tell you you're fine and worried well, than sick beyond the point of repair and a fool for having ignored your symptoms. She thought she had pneumonia. Turns out it was stage 4 lung cancer. She was 31. I worked in an ER fast track when a mother brought her 8-year-old daughter for abnormal discharge. Aside from the age, this is nothing unusual as we see many complaints like this throughout the day. The mother thought nothing of it, maybe she's on her period. The doctor, however, was suspicious from the start, so he ordered a gonorrhea chlamydia test which turned out positive for gonorrhea. Unfortunately, he had to discharge the patient on the initial day due to some tests, such as cultures, taking much longer to result. But the very next day we checked the results and immediately started calling CPS. The mother was not happy, to say the least. Not a doctor, but this did happen to me. I had gallstones for 3 years or so before I finally got my gallbladder ripped out last year. At its worst, I was getting an attack maybe once a month or so I figured it couldn't be that bad. I went to the surgeon for my post-op checkup. He told me that my gallbladder was filled with hundreds of stones of varying sizes and that it was precancerous. Apparently, People don't typically get gallbladder cancer until they are in their 80s or 90s. And it is often very serious because people don't catch it right away. I'm in my 20s and like I said, I had been sitting on this problem for 3 years before I finally toughened up enough to get it checked out. Scary man. Not a doctor but a nurse. I was working in postpartum care and I cared for a patient who had come into the hospital in labor with her first child. She ended up requiring a C-section. In the OR, they opened her up and found her belly full of cancerous growths. They immediately paged an oncologist at a neighboring hospital. We were just a women's and children's hospital to come immediately while she was still open. It wound up being terminal. She wouldn't even have known if she hadn't needed that C-section. Can you imagine going to the hospital to have your first baby and leaving with a diagnosis of terminal cancer? I think about her all the time. This obese, 400 plus lbs, women came in complaining about her stomach hurting. Turns out there was a dead baby in her V. It was there for a few months and she had no idea. Edit. It was everywhere. Not just in the V. MB. Obligatory. I am not a doctor but my friend went to the doctor because she had swollen lymph nodes in her neck. The doctor told her she had some infection and gave her a prescription. A week later nothing had changed. She went to the hospital and was diagnosed with Hodgkin's lymphoma. She was supposed to have only 6 months of chemo, but it took her 2 years of chemo and a bone marrow transplant to be cancer free. I saw a 55-ish woman at the ER last year. She asks us if she might have something wrong with her breast. During my exam, I couldn't help but notice that her left breast was bumpy, talking like 5 centimeters mass protruding. The nipple was inverted and leaking blood. Clearly a textbook case of cancer. The woman had a pretty high paying job and seemed pretty smart, and was clearly in denial. Dad went to the optometrist. She noticed something funky in his eyes, blood vessels. Referred him to cardiologist. 390+% blockages in his heart. Someone needs to post a link to our eye bleach, or a reminder that today really isn't that bad of a day, and that you're in good health for someone your age, weight, sex and or gender, and not riddled with cancers filled to the brim with anything but love and sunshine. And get that it to the top comment slot, because a lot more people need to see it before this cavalcade of misery. My girlfriend is in her final rotations for radiology. A while back a young girl came in after winning a basketball championship. She had some shooting shin pain but wasn't in a lot of pain. Still glowing from the win and talking excitedly about a scholarship offer. When her scan came back, about 60% of the marrow in her tibia was one big sarcoma. Cancer. Surgery and therapy essentially ended her shot at a full ride. My friend's mother was on vacation in Key West and as they were walking down the beach her husband pointed out that the toes on her left foot were all sandy and the other one wasn't. She had been kind of dragging the front of her foot, but only on the one leg. The mom vaguely mentioned that she'd been kind of having a little trouble lifting the front of her foot up, but figured she just strained something from running barefoot on the beach a few days earlier. She went to a doctor to see if she could get some anti-inflammatories. After questions and recommendations to see a specialist, they figured out that she has ALS, Lou Gehrig's disease. This was 6 years ago. Now she is totally unable to move, talk, and breath on her own. All she thought she had was a sprained foot. Paramedic here, but at the time I was still a student. PT was brought in for back pain. They decided to do a bedside ultrasound because they felt a pulsating mass in her abdomen. She was about one funny movement away from her aorta exploding. I just saw Theory of Everything and the scene where Hawking goes to the doctor for what he thought was a sprained wrist was heart-wrenching. We had a guy who showed up to the ED with a bad cough. His wife kept saying that she had tuberculosis 20 years ago and although she was treated at that time she was convinced he had it. His symptoms were far more consistent with pneumonia and he lacked classic TB symptoms. We got an x-ray and sure enough it was TB. Now I have to do several blood tests over the next few months to ensure I don't have TB. Sometimes the patient is right. Another time I saw a lady in the ED with a chief complaint of headache. She basically provided no history and just kept repeating that her head hurt. I tried to get some background, past medical history, etc. but she wouldn't say anything other than my head hurts, give me something for the pain. On her chart she had tons of previous visits for vague complaints and requests for narcotics which all resulted in basically nothing. So I initially thought maybe she was drug seeking, but her behavior just seemed odd. We decided to scan her head and left to go see other patients. I came back a few minutes later and her husband was there now. I asked what happened and he said she was just standing in the kitchen cooking when all of a sudden she dropped to her knees and then immediately complained of a horrible headache. While I was talking to him she began vomiting all over herself. We rushed her to CT and she ended up having a subarachnoid hemorrhage, bleed in her brain. She was taken straight to surgery and ended up being fine after spending about 6 weeks in the hospital. This one isn't nearly as scary as the others, and I'm pretty late to the party, but here's my story. I have male pattern baldness and needed a prescription for some hair growth medication from a dermatologist. The doctor said he would give me a prescription, but first wanted to do a full skin checkup, which he does for every new patient. I got annoyed by the fact that I had to strip naked in front of this guy just for hair medicine. Few weeks later I get a call. There was melanoma cancer on my back. They caught it early enough that it hadn't spread. That checkup saved my life. I work for the fire department and once a month we have to do body recovery, pick up dead bodies. Well, one day we were sent to the local hospital to pick one up, a 48-year-old female. She came in with a stomachache at 7 AM and while they were running tests she died at 11 AM. When I picked her up they hadn't gotten tests back and I never looked back on the autopsy, but it's just crazy how the first time she complained of this stomachache she was dead. All these appendix stories reminded me of one from school. I guess it's slightly off topic because no doctors are involved. My friend and I got detention for PE. I can't remember why, but after school when we went we had to run laps around the gym for a certain amount of time. But my friend was complaining of a stomachache. The teachers thought he was lying to get out of detention, so made him keep running anyway. He ended up collapsing and being taken to hospital. Had appendicitis. Apparently he could have died if he was made to run much further. Many 50-60 years old patients with a history of smoking going to the hospital for a persistent cough or a bad headache caused by an advanced lung cancer with brain metastasis. I had a patient on one of my rotations who came to the ED for back pain. Imaging revealed that he also had a pulmonary embolism, which meant he needed anticoagulant therapy for months afterwards. A few days later, when his back pain wasn't responding well to medication, it was found that he also had a spinal infection, which meant he needed weeks of IV antibiotic therapy. Nice guy. Terrible luck. One time I was in severe abdominal and lower chest pain. I tried to tough it out but it got bad. Went to the doctor, and I was laying on the table when the DR pushed on my stomach to see how much it hurt. I suddenly belched incredibly loud and for a very long period of time. I thought I was going to pass out from belching. After that I was fine. They decided to give me an EKG, and then they found nothing. I was fine. This Reddit needs a non-freak out causing story.